Good afternoon. My name is Shelley Campanola. I'm the Executive Director of Compass Refugee Centre, and I am your MC for today. Compass, formerly known as Mennonite Coalition for Refugee Support, has directed many refugee claimants to Sanctuary Refugee Health Centre for help. It is my pleasure to welcome all of you to this legacy celebration event. We hope you have enjoyed seeing something of Sanctuary as it exists today. Thank you to Minar for her beautiful music. My first task is to set the context for our celebration. September 30th, 2021 marked the first National Day for Truth and Reconciliation, a day to honor the lost children and survivors of residential schools, their families, and communities. A public commemoration of the tragic and painful history and ongoing impacts of residential schools established by a colonial government. On June 6, 2021, a refugee newcomer Muslim family innocently walking on a London, Ontario street was brutally attacked in an act of hatred. How can it be that such acts of wanton violence continue? Those of us who now live well on the economic products of colonialist success have need to examine the individual and collective parts we play in perpetuating oppressive ways and social injustices that make such success possible for only a select few in contemporary society. In December 1854, Chief Seattle, a Squamish chief who lived on the islands of the Puget Sound, is on record in which he quoted as saying, "The president in Washington sends word that he wishes to buy our land. But how can you buy or sell the sky? The land. The idea is strange to us. If we do not own the freshness of the air and the sparkle of the water, how can you buy them? Every part of the earth is sacred to my people. Every shining pine needle, every sandy shore, every mist in the dark woods, every meadow, every humming insect, all are holy in the memory and experience of my people." Justice Murray Sinclair challenges all of us to listen and learn from those who have suffered. Reconciliation calls us collectively to find new ways of giving hope and new ways of singing both sad and joyful songs in harmony with all people and with creation. Sanctuary Refugee Health Centre and the Kitchener Downtown Community Health Centre are situated on land that is the traditional home of the Neutral, Haudenosaunee, and Anishinaabe peoples. We extend our respect to all Indigenous, Métis, and Inuit peoples for their past and present contributions to Turtle Island and this part of it called Waterloo region, and our commitment to learning from them, especially about the land. With that thought, we would like to take a moment of silent reflection. Thank you. Throughout this program, we will hear musical performances and see presentations and messages from individuals key to Sanctuary's success and endurance in this afternoon of Thanksgiving and celebration. The first of these is from Dr. Michael Stevenson, the founder of Sanctuary. Dr. Mike is hardly a stranger to us and needs little introduction. He will share the vision he had for Sanctuary when he opened the clinic on April 4th, 2013, Refugee Rights Day, and the story that has followed.
Hello, I'm Dr. Mike Stevenson, the founder of Sanctuary Refugee Health Centre here in Kitchener. Thank you so much for joining us today with what I hope will be a very lovely event and one where we get to thank you, people who have played such a vital role in Sanctuary over the last few years. So Sanctuary began 8.5 years ago now. It's hard for me to believe sometimes how long we've been running. And we began really as a place for people to come, people who lived in our community every day. Many of whom work here, many of whom have kids who go to school here, and yet really were not a part of our community. They were being denied care, or they were finding it hard to find the type of health care that they needed in order to really adapt and move forward in their life here. We spoke to many people before we opened just about the challenges with healthcare. And what we designed was a place for them to come that would be responsive to their needs, and help them reach their goals and their dreams here in Canada. When we started, we had 6 patients, and never in my wildest dreams would I have thought that we would grow to what we are today. 5,500 patients, 1,500 or more on our waiting list. And we believe the largest refugee health center anywhere in Canada. I think really that growth is a testament to the kind of work that we are doing, really meeting the patient where he or she is, both in terms of language, in terms of culture, in terms of understanding of the system, but also really trying to see the world through their eyes as much as any of us can do that, and really addressing the inequities, the injustice that exists within our system. The Canadian healthcare system is a very bizarre thing. It's something that many of us who were born here and lived all of our lives have trouble understanding sometimes. I'm still baffled by how we expect people who are newcomers to the country to adapt to some of our systems. And sometimes those systems are well-meaning and exist to for a certain reason, or exist because they've always existed this way, and yet are shutting people out of the kinds of care that they need, the kind of care that they ought to be receiving. So that's really why we exist, why we're here, to try and help to address those injustices, those inequities, and help our patients meet their goals and remove those barriers that exist, preventing them from doing that. I don't like to think that we do things for people. I like to think that we help people to do things for themselves. The donations and the support that many of you have provided us have been essential to the operation of Sanctuary over the last 8.5 years. We could not have done it without you. I think of some of the fundraising and some of the generous donations, financial donations that have gone to us, that have helped us expand physically, to allow really unique programs to happen. So, building the space has allowed people from various programs, various agencies to come in and offer their services here on site, so that people don't have to cross town to go somewhere else to get the services that they need. They can come to a familiar location, a place that they feel at home, and get their questions answered. I could not do this work without the support of many of you. Many of you have been very generous in your time and volunteering in helping us meet those goals. And I'm eternally thankful, eternally grateful for the work and the efforts and the generosity and the spirit that many of you have shown. So thank you so much. And from the bottom of my heart, thank you for all that you have done for us.
Thank you, Mike. Hope and resilience, two characteristics of refugee newcomers nurtured at Sanctuary, and now shared through two pieces of music by Dawood Ornsby and the Inshallah Choir.
This next song that we want to share with you is actually about 1,400 years old. This song comes to us from the Muslim tradition. It's kind of the one-hit wonder of the Islamic world, in fact, you could say. And it may, in fact, be the only hit. No, it's called Ta'ala al-Badru Alayna. And very similar to those of you who maybe have grown up in the Christian tradition, and you may remember those stories from the New Testament of Jesus' entry into Jerusalem and how he was welcomed by his companions and his disciples. Well, he and himself and in his own mind knew the tensions that were brewing there. Well, this song came at a time when Muhammad, in the 7th century, was forced out of his own city of Mecca, the city where he had grown up and been born and raised, by his own tribe, and was forced to live with sanctions upon him and his companions in the desert. And it was actually a city about 300 miles away called Yathrib. And in that city there were tribes of Jews, tribes of Christians, tribes of pagans, and they had heard about Muhammad, and they had heard about his honesty, and they sent a delegation saying to him, "We know that you've been kicked out of your city, and we will give you sanctuary. We will give you safety and stability and security. If you come to Yathrib, bring your companions, and we will help you if you help us find peace between our tribes." So he made that trek, and it was customary in those days that the leaders of all the tribes of a city, when a newcomer was coming to their town, especially an esteemed guest, that the leaders of all the tribes would go out into the desert and would meet that individual and bring them through the gates, so that all of the people of all the city would know that that person was to be given safety. And so if you can imagine, 1,400 years ago, all of the leaders of the Jewish tribes, the Christian tribes, the pagan tribes, and the Muslims of Yathrib going out into the desert to welcome Muhammad and his companions through the gates of Yathrib, welcomed by the women and children singing this song. طلع البدر علينا من ثنيات الوداع وجب الشكر علينا ما دعا لله ده. All the white moon rose over us from the valley between hills of sand, and we owe it to show gratefulness when a call to God fills our land. To be obeyed, you have brought to this city nobleness. Welcome you who call to the best way.
Sanctuary is like a very large family, and they want to share with you what it means to be a part of that family and why they want to thank you, the people of Waterloo region, for your support.
Hello everyone, my name is Zainab Mana. I am Patient Support Coordinator as well as Cultural Interpreter at Sanctuary Refugee Health Centre. What that means that I coordinate the work of many of our staff in interpreting cultural understanding and misunderstanding. This is a role unique and critical to Sanctuary Refugee Health Centre. When Sanctuary opened its doors in 2013 in a church library with 6 patients, little did Dr. Mike know that we are on a journey of creating a family of over 5,000, representing 84 countries that transcended race, creed, and gender. Sanctuary was about providing a space where everyone could have their healthcare needs met with dignity, respect, and inclusion. Over time, it became a place where our clients were our partners in health. Our clients, truly our family, allowed us to develop and expand by giving us constructive feedback and supporting us every step of the way. By celebrating diversity, more ideas were brought to the table from varying perspectives and backgrounds, helping to meet the complex needs of so many. This has meant having difficult conversation within our community and within our partners. When we have seen an intended bias and the cultural incompetence, we work together with providers and the clients to avoid stereotyping and increase awareness of cultural difference. And we grew. None of that growth, in fact, none of this amazing work would have been possible without the KW community support. Thank you for helping make this clinic what it is. A place where diversity and the difference is a central strength, not something to be feared. We are a manifestation of cultural kaleidoscope, illustrating and the strength in diversity means what true health, equity, and inclusion look like as a newcomer contribute to a rich and evolving demographic. It is because you helped create this. So I salute all of you, and I am excited. Inclusive healthcare will take us where we will take us. Thank you very much. Merci beaucoup. شكرا جزيلا. مع سنت.
Thank you, Mama Zainab, and Sanctuary's children for your words of appreciation. Appreciation can be expressed in many ways. The Waterloo Arts Fund has made it possible to do this. Bill Chesney will tell you about the award that has made a lasting tribute to your generosity possible. Then we will watch a presentation about the new mural and its artist, Pamela Rojas, followed by a song of thanksgiving by the Gataco Singers, recorded at the Mayor's Dinner in 2019, put on by the Working Center.
Hi, everyone. I'm Bill Chesney, Board President for the Region of Waterloo Arts Fund. We're very proud to have supported the creation of Pamela Rojas' beautiful ceramic installation for the Sanctuary Refugee Health Centre. The Arts Fund mandate is to make art happen in our region. We aim to support our resident artists in producing diverse works that are variously engaging, provocative, uplifting, challenging, the whole range of creative expression and impact in all disciplines for everyone in our region. The result being celebrated here today is a perfect example of the Arts Fund's goals in action. Pamela Rojas will be familiar to many for her exuberant, engaging, disarming, colorful style, expressed in indoor and outdoor murals, as well as ceramic creations and myriad drawings and paintings. Here, her work deftly combines the framing device of the center's logo design with ceramic tokens she has created. These tokens are themselves individual symbols of the stories of resilience, hope, perseverance, and welcome that she has collected in her consultations with the community. Visitors to the Sanctuary Refugee Health Centre can find those symbols that most resonate with their own life experiences, all cradled in the harmony and unity that circles have always represented. Bravo, Pamela. Bravo, Sanctuary. And thanks for this opportunity for the Region of Waterloo Arts Fund to express our appreciation and support for your work.
My name is Margaret Brockett. I have the privilege as Associate Director at Sanctuary of introducing Pamela Rojas, the artist, and the mural. A Refugee's Journey, funded by the Waterloo Arts Fund, was created in 2020 to commemorate the work of Sanctuary Refugee Health Centre over 7 years. It was designed by Pamela Rojas, an artist from Chile. Pamela has spent 20 years in Waterloo region, working and journeying with Canadian newcomers through her art and sharing her personal story, the stories of refugees living at Reception House, and her work with Family and Children's Services on the Resilience Project. A Refugee's Journey was designed to complement the Sanctuary Refugee Health Centre logo, representing the different phases and emotions of refugee life as they heal from their trauma, find new hope, and settle in Canada. Sanctuary supporters and children were invited to draw pictures of what the journey looked like to them. Pamela used those drawings to create the symbols represented in each of the ceramic circles, showing the new understandings of refugees as they adjust to a new and sometimes very strange life. Conflict. The first circle is the darkest, when, on arrival, so much is unknown and may be to be feared. We see snowflakes, polar bears, guitars symbolizing the cultural and musical differences, symbolic animals such as the moose, and many other small images that depict first impressions of Canadian culture to a newcomer. Healing and new hope. As the circles progress into lighter pigments, the images represent increasing comfort and integration into this new world as each person experiences Canadian culture for themselves. They find themselves navigating new freedoms like gender equality, as well as embracing Canadian winters and learning how to live in this new culture and society. Well-being and harmony. In the final 2 circles of a refugee's journey, the pigment fades into its lightest pink, representing well-being and harmony with a new culture that retains a refugee's heritage as well as a sense of belonging in the Canadian community. The Refugee's Journey is a Sanctuary's gift to Waterloo region. Mounted on the wall behind the reception desk, it will be seen by patients, staff, and visitors to the clinic. It will be a lasting reminder of the many donors and friends who have supported this work of healing that truly gives new hope to those fleeing conflict and war. Sanctuary Refugee Health Centre has depended on the generous support of partners, collaborators, and friends in the community. On the donor wall, we especially want to recognise the major donors to Sanctuary's 2-year capital campaign, launched in 2018 to raise $250,000. MPP Laura May Lindo represented the Trillium Foundation at a formal appreciation event in January 2020. Brenda and Len Jewett, long-time residents of Waterloo region from Mennonite roots, who, through Abundance Canada, generously contributed to construction costs and the window coverings. Lindsay Campbell and her husband Scott shared their expertise and advice and introduced us to key people in the Ontario Ministry of Health. They encouraged us to build a hub of embedded refugee healthcare services while lobbying for sustainable funding. Following Scott's untimely death in September 2017, Lindsay generously donated in his memory. 100 men who give a damn are just that, local businessmen who commit resources annually to worthy causes. Sanctuary was pleased to be the recipient of their generosity in 2018. The countless volunteer hours painting, assembling and moving furniture, taking laundry home week by week, and other gifts in kind have made the clinic a welcoming and friendly place. Our partners and facilitators listed here represent the incredible support of a generous community. Highlighted are the Canadian Mental Health Association and the Kitchener-Waterloo Multicultural Centre, who committed paid staff to work at Sanctuary. Significant donations have been made by faith organizations, businesses and individuals, friends and families of Sanctuary staff and volunteers. In particular, I would like to recognize the late Mrs. Doris Gasho, remembered with love and gratitude in a legacy celebration in March 2020, which was the inspiration for this event. Big things do come in small packages. It is all those unknown and unheralded gifts that have made possible Sanctuary's lasting legacy to the Kitchener-Waterloo community. Thank you, every one of you. We continue to move forward into the unknown with thanksgiving, hope and resilience, singing with our young friends Patrick, Set, Deborah and Mika, who arrived from Central Africa just 4 years ago last month. This performance was at the 2019 Mayor's Dinner given by the Working Centre.
Kucho yavuze nzogera naho yambwiye kuko Imana atari umuntu ngwibeshe iyo ivuze biraba yategeka bigakomera nifite ijambo rya nyuma kuri nge nzogera kuco yavuze nzogera naho yambwiye kuko Imana atari umuntu ngwibeshe iyo ivuze biraba yategeka bigakomera nifite nifite ijambo rya nyuma kuri njye. Isi yuzuye ibiteye ubwoba n'ibiduca intege, umwijima utuma tutareba imbere iyo tujya. Isi yuzuye ibiteye ubwoba n'ibiduca intege, umwijima utuma tutareba imbere iyo tujya. Nubwo bimeze bityo zi neza icyo Imana yavuzeho, kuko ari nta jambo Imana ivuga maze ngo rihere. Nubwo bimeze bityo zi neza icyo Imana yavuzeho, kuko ari nta jambo Imana ivuga maze ngo rihere. Nzogera kuco yavuze, nzogera naho yambwiye, kuko Imana atari umuntu ngo ibeshe. Iyo ivuze biraba, yategeka bigakomera. Nifite ijambo rya nyuma kuri njye, nifite ijambo rya nyuma kuri njye, nifite ijambo rya nyuma kuri njye.
Thank you, Bill, Pamela, and all who have contributed to making Sanctuary what it is today. Thank you, too, to the Gitako singers. Patrick has said that the overall expression of this song is, though we go through hardships and many trials, what God has promised will come to pass. The way might be dark, and it might seem that there is no hope. Nevertheless, what God has said will come to pass. Unexpected life events like pandemics do mean many dark days and hardships. However, they also give us a new appreciation of our friends. A marriage of Sanctuary with the Kitchener Downtown Community Health Centre was already planned when COVID hit. Though that relationship could not be sealed immediately, it is fair to say that the commitment of the KDCHC Board of Directors was a lifesaver for Sanctuary. Their chair, Rob Howe, followed by CEO Inka Brozic, will share what that commitment is all about.
Hello all. My name is Rob Howe, and I have the honor of being the current chair of the Kitchener Downtown Community Health Centre Board of Directors. It is my pleasure to join with you all as friends of the Sanctuary Refugee Health Centre as we take time to celebrate and show appreciation for all the work done since 2013 and look forward to a successful integration between the Sanctuary Refugee Health Centre and the Kitchener Downtown Community Health Centre. When I review the history of Sanctuary, which opened in 2013 with capacity for only 6 patients, and eventually growing into a new space in 2017, and ultimately to its current home, where it's one of the largest refugee health centers in North America, I do take pause. The work done thus far has touched thousands of individuals and families, and is critical given that the Kitchener-Waterloo area is home to more refugees than any other community in Ontario outside of the GTA and Hamilton regions, and is a top location for government-assisted refugees and secondary migrants. It is known that access to healthcare is a challenge for these individuals and families, and Sanctuary has worked hard over the years to provide the care and coordination that these patients deserve. I believe it would be difficult to find a better partner to integrate with than KDCHC. As one of over 100 community health centres in Ontario, KDCHC has and will continue to serve the most marginalized and vulnerable members of the community. While not solely focused on the refugee population, KDCHC's priority populations are individuals and families impacted by the social determinants of health, including newcomers to Canada, those experiencing homelessness or who are precariously housed, those with mental health and addiction challenges. The desire to help those in need most is what runs deep in both organizations and will continue on into the future. As we look forward to furthering the integration between the two organizations, there's still much work to do. Previously, the board had created an integration committee which has been meeting to support the initial work. However, we acknowledge that this is just the beginning and there's still much to be done. Timing is good though, as KDCHC is embarking on kicking off and developing a new strategic plan. This strategy will focus heavily on the integration between Sanctuary and KDCHC, and we will seek and work to engage all of our stakeholders. These include staff, clients, partner agencies in the community, and others that needed of both KDCHC and Sanctuary to gather feedback and develop a focus for the next 3 years. Prior to turning it over to Anker Brozik, CEO of KDCHC, I want to close by saying, on behalf of the whole KDCHC Board of Directors, I want to express my gratitude to Dr. Mike and the whole Sanctuary family for the passion and effort put into caring for our refugee community all these years. It is exciting to think about how we can work together, Sanctuary and KDCHC, to continue providing the care to those who need it, as well as acting as a voice of change and advocacy across the broader health system. Change can be both difficult and desirable, scary and exciting, challenging and needed. And as we move forward together, I ask for openness, are willing to participate, and ultimately trust that both organizations, Sanctuary and KDCHC, have a similar care of providing goal of providing the highest quality care to those who need it most, today, tomorrow, and well into the future. Thank you all.
Good afternoon, everyone. My name is Anker Brozik, and I'm the Chief Executive Officer of the Kitchener Downtown Community Health Centre and Sanctuary Refugee Health Centre. Today, I think we are humbled by the pictures, videos, and stories we've heard that all speak to the story of Sanctuary, the legacy of Sanctuary. Sanctuary began with one person's vision that everyone, including newcomers and refugees in Canada, deserve excellent health care and deserve to be treated with dignity and respect. Soon, others, inspired by Dr. Mike's work and vision, started to knock on his door asking simply, "How can I help?" Since 2013, Sanctuary has grown from 500 to over 5,000 patients. In 2020, in order to be able to at least sustain and ideally increase the services to refugees at the health center, Sanctuary integrated with the Kitchener Downtown CHC. The Kitchener Downtown Community Health Centre was established over 20 years ago and is one of over 80 CHCs in Ontario, and primarily supports those that are experiencing homelessness, those that struggle with mental health and addictions, and others, including refugees, that are impacted by the social determinants of health. Sanctuary and KDCHC both follow the Community Health Centre model. We serve people that are most marginalized in our communities and that are most vulnerable. We strive to develop our programs and services with the input and participation of our communities, and to make those programs and services accessible to the people that need them most. Another element of the Community Health Centre model is community governance. That is to say, the members of our board, all volunteers, live in the community or have knowledge of the communities we serve through their work with partner agencies or through their volunteer work. Our board members also bring expertise in other important areas with knowledge of finance, law, human resources, research, and education. I'm very pleased that this year we have 4 new board members that have been involved with the work of Sanctuary in the past. This is very important it is vital that we have the sanctuary perspective and sanctuary voices at the board level. As our chair, Rob Howe, mentioned, the board of directors is beginning the strategic planning process that will help inform our goals and decision-making for the next 3 years. It is vital that we have the input of the communities we serve, all of our staff and other stakeholders involved in this process. So as we honor the legacy of Sanctuary today, we also celebrate the integration of Sanctuary and KDCHC. We celebrate that the tremendous work that Sanctuary does in the community will be sustained and expanded as we work with our funders and partners in the community. I would just like to highlight some of the important work that has been done already. In the last 18 months, we have had all staff meetings, bringing the staff of both sites together to tell our stories of who we are and what our journeys have been as organizations. We have discussed what we want to bring with us on this new journey and what we are willing or happy to leave behind. In order to move forward as one effective organization, we will continue to provide every opportunity for staff engagement and communication with leadership. Last year, we introduced a new electronic medical record at the Sanctuary site that helps us to support and streamline our patient charting practices and ensure accurate quantitative and qualitative data for our funders so that we can continue to gather the information we need to tell our story and seek the resources we need to continue to successfully deliver programs and services to our priority populations. Recent renovations at Sanctuary have increased the capacity to see patients in 6 new exam rooms, and high-speed business-grade internet has been added. Aging computer hardware has been replaced with new desktops, laptops, monitors, and other needed hardware and software. The Sanctuary site is now wired with an alarm system. All of these things have made the center more accessible for clients and a more safe, comfortable, and productive work environment for staff. In addition, to enhance services to patients, we've been successful in extending funding to keep the services of our social worker at Sanctuary and have submitted proposals to bring a full-time midwife to the center, as well as more physicians, more nurse practitioners, more RPNs, more social workers, a chiropodist, a pharmacist, and more administrative staff, all to support the needs of Sanctuary clients. Now, in the midst of our integration, the provincial government introduced its plan to redesign healthcare in Ontario. The goal being to have many agencies working together to provide integrated and coordinated healthcare services to people in their communities. The Kitchener Downtown CHC, including Sanctuary, is a member of the KW4 Ontario Health Team. Collectively, we are working with over 40 other member agencies, including other primary healthcare organizations, social services organizations, and our 2 hospitals to provide wraparound services and the highest quality healthcare to over 400,000 people that live in Kitchener, Waterloo, Wellesley, Wilmot, and Woolwich. The KW4 OHT has identified 3 priority populations to focus on. They are refugees, the homeless or precariously housed, and the frail elderly. A working group has been established for each of the priority populations, and KDCHC leads the work for the Refugees Health Working Group. Through our leadership, we have submitted a proposal of a model that could increase the number of settled refugees rostered to family doctors in the community. This would allow Sanctuary and other refugee clinics to move people off of their waiting lists and into their clinics. This would help new refugees get appropriate primary health care much sooner. In closing, there is a feeling you get when you walk into the Sanctuary Clinic. It is a place that embodies warmth, caring, understanding, and it is a place of belonging. Since meeting Dr. Michael Stevenson and the staff and the volunteers at this very busy clinic, I have come to understand that the legacy of Sanctuary is its people. It's the staff, the patients, the volunteers, the partnerships, and the generous support of donors, all working together, that has made it a pillar of refugee healthcare in Canada. Like the people that have come to Sanctuary from faraway places, our two organizations are on a journey. And every journey has its challenges, but we are finding our way. One thing I know for sure is that as long as we work together to overcome our challenges, we will be stronger and we will do better together for the communities that we serve. Thank you.
How will Sanctuary's legacy be carried forward? Please make sure your hopes, your concerns are conveyed in some way to Anka Brozik, CEO, and to the board for their consideration as they work on the new strategic plan. Watch your email inboxes for a follow-up email with details. It is now my privilege to thank those who have put this virtual event together. Kevin Brink, Maria Alhana, and Summer Fry, working tirelessly with the support of Ada Dede, Sachin Karbana, Kyla Blair, and Martha Knowlton, coordinated by convener Margaret Brockett. And now we want to, I don't have it in my script. Excuse me for just one moment, friends. We have something special here. Live. One more thing. I would like to welcome back Anka Brozik, CEO of KDCHC, to give a closing message of thanks.
Thank you very much. So thank you everyone, first of all, for attending. And I'd like to, before we end today, I'd like to recognize the tireless work of a very special person, someone very vital to the whole Sanctuary story and to this event. I'm speaking, of course, of Margaret Brockett. Thank you, Margaret, for your many valuable contributions over the years. As many of you know, Margaret has been a champion for Sanctuary and instrumental in promoting the values and cultures of this small clinic that is a giant in terms of the support and care that it provides to many refugees and newcomers in the Waterloo region. Over the years, Margaret's been heavily involved in grant writing, supporting research, welcoming international medical graduates, and precepting students at Sanctuary. She's had numerous other roles as well, of course. In many ways, Margaret, you've helped Sanctuary become the outstanding clinic that it is, and also the village that it is. A village where you can find many family and friends. So from all of us, thank you. Thank you also for all your work in convening and organizing this really beautiful event. So as a small token of our thanks, I have something we'd like to give to you, and I wish I could do it in person, but here we are virtually still. So I'd like to present you with this diptych that was created by, it's the murals that we have at Sanctuary. We've put it together for you, Margaret, so that you can have it at home. And we will get this to you very soon, but we wanted you to have this from us to you. Thank you so very much for all of your work. Thank you, everyone.
Wow. Thank you, Anka, for your message. Margaret didn't know that message was coming, and she deserves so much thanks for everything she's done for Sanctuary during her long tenure there. It's now time to say thank you to all who readily agreed to share their voices, and thank you for celebrating with us this afternoon. In spite of COVID, Sanctuary continues to welcome their patients, to listen to their stories, and to find ways forward that lead to their well-being. This concludes our program, and we ask to have a wonderful weekend.